When it comes to thyroid medication options, there are many. However, in my 19 years as a pharmacist, the one that I prefer patients to take is something called T3, T4 in a slow release capsule. And in today's video, we'll get into that content as to why I feel that way. If we're joining for the first time, my name is Dan. I'm the owner of MD Custom RX here in Brookfield, Wisconsin. If you stick with me till the end of today's video, I will be looking at the best time that I consider patients to be testing their labs. Now, it may seem like it doesn't matter. You can test in the morning, you can test at the night, but quite frankly, when you are taking thyroid medication, I want to test that medication and how it's working in your body, not what you're producing endogenously. Or if I test a day later, really that medication essentially is gone. Okay, let's get into today's topic of thyroid medication options. I said simple, but it could be a little complicated.
It might be long.
All right, so yeah, blue door, red door. Kind of reminds me of the Matrix movie. It's like blue pill, red pill, which one do you want to pick? Because there's no going back, whichever one, you know, the door we go behind. All right, so the most commonly prescribed medication in the world is this drug right here, levothyroxine. Synthroid, goes by a lot of different names. So Synthroid is probably the most common brand name in America. Generic for that is levothyroxine, levothyroxine sodium. You got Levothyroid though, I put the rest of the names up there, Unithroid. T4 is T4 is T4 is T4. Yeah, there's different fillers, so on and so forth, different colors. The Tyrostin is a little bit unique. It doesn't have all the binders and fillers. It's got like glycerin water and it's a gel cap, but ranges 25 to 300 micrograms. Oh, I have a typo there. There should be a C right there. Sorry. 300 milligrams would probably give somebody a heart attack. So again, it's levothyroxine, it's T4, but the point on this slide is, again, T4. If you go back to that picture of the cell, the nucleus, the receptor is only specific to T3. So you can feed somebody all the T4 that you want. If there is an issue with getting T3 inside the cell, into the nucleus, onto that receptor, the T4 is not going to be a great option for them. So you can kind of push that a little bit and you can get that patient feeling better for a little while. And then they're going to hit a wall and feel like crap again. And then the doctor's going to be like, oh, let's measure your TSH. Oh, it's not where it needs to be. I'm going to give you a little bit more. And I've seen that over the last 19 years of being a pharmacist. You just, every year or so, that patient's dose of thyroid goes up a little bit more and a little bit more and a little bit more. Doesn't really fix anything. It's a Band-Aid.
Where does armor thyroid
Get into, yep.
Where does that come in?
Two slides from now. Yeah. So T4, so T3 is your leothymine. Your brand name is Cytomil. You got the generic leothymine sodium. You got three strengths. You got 5, 25, and 50 microgram. Commercial products that combine. So now we got T4 by itself. We got products for that. We got T3 products. Let's look at combination products. So here's your Armour thyroid slide. So that's a combination of T4 and T3. It's got the best of both worlds, if you think of it that way, if you want to think of it that way. 1 grain is equivalent to 9 micrograms of T3, 38 micrograms of T4. The problem with that, if we really look at it from a functional medicine standpoint, is the body really doesn't produce from a 1 to 4 ratio in the body. It's usually about a 1 to 9 ratio. It really depends on the patient. There's no, I shouldn't even say that. There's many different ratios of T3 and T4 production in individuals. The point is we want to measure the free fraction of T3 and T4 and dose the medication based on that patient's levels, not just stick them with a 1 to 4 ratio of T, because they might not need as much T4 as they do T3 or vice versa. So this is I would say a better option because you've got inactive and active hormone now, but it's still not, it may not be the right ratio for that particular patient. So I get that question at least every month, if not every week. So I want to go on something natural for thyroid. I'm sick of taking Synthroid. It's not working. And I agree, it's a better choice, but I think we can even take it one step further than that. It also contains pork, calcitonin, selenium. There's that infamous T1 and T2. I'm not going to get into that tonight, but there's those two other hormones that are out there from the thyroid gland. There's a lot of brand names: Armour Thyroid, Nature Thyroid, West Thyroid, NP Thyroid. I might be missing a few, but that's the general list that I most commonly see. So that's thyroid USP. It's a standardized extract. Essentially, I don't want to get into that debate tonight. I'll have doctors calling me tomorrow like, that's not standardized. How can you raise all these different, that pig, versus the pig farm down the road versus the pig farm across the country? Are they all fed the same diet? Do they all produce the same amount of T3 and T4? No, they don't. But there's ways that chemists can standardize that thyroid extract. And again, in my opinion, I think it's better than just doing T4. All right, so compounded preparations. So this is what you can get at a pharmacy like ours. So you've got active pharmaceutical ingredients available. I have pure T3. I have pure T4, 0 fillers. I've got pure porcine thyroid. It literally smells like pig gland. And if you're curious why I know how that, you just smell it. It just doesn't.
Just lots of water.
Yeah. So we can make capsules. We can make immediate release capsules. We can make slow release capsules. I have a patient that's been on a T3, T4 suspension for years now, just in an olive oil, which he's been doing very well with. So we've got a lot of different options outside of just your standard Synthroid or Cytomel tablet. The nice thing I'll say about T3, so the half-life on let me step back a little bit. On T4, the half-life is about 3.5 days. So it's a very long. So you can take your T4 as an immediate release dose and your body will take it, metabolize it, and kind of run through the course. With T3, the half-life is very short. I don't even remember what it is, like 12 hours. It's maybe even less than that. And so if you give somebody a big dose of T3 all at once, they're going to be really jittery. It's not a natural way to get all your T3 in your body, because you got to think this gland makes thyroid hormone basically on demand. And so it's not just, and so it's kind of just, it releases it as it needs it. And it's releasing it as it needs it essentially throughout the entire day. So if you give that patient all of their T3 at once, at one dose in the morning, they might feel good for like 2 or 3 hours, and then they're going to crash and again feel like crap the rest of the day. So the way around that is give them a slow release capsule, and that capsule will release over 8 to 12 hours, and you dose them twice a day. They're going to have a nice steady stream of T3 throughout basically 24 hours a day, which is beautiful, and the patient's going to feel beautiful. One of the questions I always get is, doesn't my thyroid medication, won't that keep me up at night? It'll cause insomnia. And it can, but if it's dosed appropriately, typically it will not cause insomnia. So we have patients that will take their T3 and T4 at bedtime, and they'll be fine. They'll sleep perfectly sound. It's got to be dosed appropriately. Typically it's got to be in a slow release fashion, though. Talked a little bit about this, but I'll just read the slide. So pro tips for taking any thyroid hormone. Make sure you're taking it on an empty stomach 30 to 60 minutes before food. Patients always ask me, well, which one is it, 30 or 60? I don't care. Just keep it consistent. If you're going to do 30 minutes, then do 30 minutes. If you're going to do 60 minutes, then do 60 minutes. Because then, and again, do your lab, and we'll talk about this in a minute too, but keep your labs, just keep everything the same. So if you do it 30 minutes and then you eat, you're going to get some binding with your food, your breakfast, but that binding will be consistent day to day, day to day, day to day. And 3 months later, when I test your labs, I'll have that idea that, okay, everything was consistent on what you did. Take it 4 hours apart from iron, calcium, magnesium. We talked about that. Those minerals will bind with your thyroid hormone medication, and you won't absorb either one of them. So just make sure you're doing your multivitamin, whatever else it is, at lunchtime down the road. I hope you learned a few things about thyroid medication options. Now, as I promised at the beginning of this video, when is the best time to get your blood drawn to assess thyroid medication? The answer is 4 hours. Now, in next week's video, I will be discussing the whys behind why 4 hours is the most optimal time, even regardless of which medication you might be taking. As always, if you found content in today's video, I encourage you to share that with a loved one or someone that is suffering from low thyroid function. And if you missed our previous videos, I will hopefully have links up here. One will be discussing how to test for thyroid dysfunctions and which labs to get. And in the other video, I will be discussing what is the best way to diagnose hypothyroidism from a functional standpoint. Thanks again for tuning in, and we will see you next week.